Here's what's coming up next on Comcast tonight. Well, it's not a miracle drug, but it's pretty darn close. BOTOX, the ins and outs, next on Comcast tonight. Hi, and thanks for tuning in to Comcast Tonight. I'm your host, Janelle Wolf, and we begin tonight with a new year, 2008. How about a new face? BOTOX can help you out with those frown lines, or as we like to call them, smile lines. Joining me now, Dr. Harriet Comite. She is a board-certified dermatologist, also a fellow with the American Academy of Dermatology, and as always, a frequent guest on our show. I appreciate you being here.
Thank you very much. I enjoy being here.
I'm excited to talk a little bit about BOTOX because it is really the only treatment approved for wrinkles by the FDA.
That's correct. It's the only treatment of its kind worldwide approved in the United States. It's been approved for the past, since 2002 by the FDA as BOTOX Cosmetic.
And really, since then, it has just kind of skyrocketed as far as the number of people that are getting this done. Men, women, and kind of all different places you can get it done,
That's true. BOTOX has many uses, but the men and women are both getting it done. It softens the frown lines. It makes you look younger. It decreases the muscle thickness, so you look more relaxed and happier.
I wanted to have Dr. Comite in the studio to actually show this procedure getting done, so we're going to roll the clip that really kind of spells it out for you. It's not painful at all, just a little pinch here and you're set to go.
That's correct. It takes about 10 minutes or less. It could be done over lunchtime. There's absolutely no downtime, and it doesn't really hurt. If most of my patients describe it as painless, but occasionally as a little pinch.
Now, Kelly, the cosmetic coordinator for Dr. Comite, is making that face on purpose, not because her face necessarily hurts, but you want to see those muscles really pronounced, I guess, where you need to get in there with the needle.
It's done a little bit different depending on the muscles I'm treating, and it's important to have that type of consultation.
Yeah, what area is that considered?
This is called the glabella, or the frown lines, the wrinkles between the eyebrows. And it softens it. Some people refer to it as the 11s because it looks like the number 11. And it also lifts the brows a little bit. What you're seeing right now is a mini brow lift with BOTOX, which I've been doing for many years. And it opens the eyes wider and gives you a very nice arch.
I'm glad you brought that up because people spend, thousands of dollars on getting this cosmetic eyelid surgery. I think I'm going to be a candidate for that someday, but what you're saying is that just with a little pinch and a couple times a year getting this injection, it creates more of a alert, awake look.
Yes, it does lift your eyes. It's what's called a brow lift, but it has to be done in a certain way by the hands of a trained dermatologist. Because there could be other side effects if it's not done correctly. And yes, it does lift it. It could put off a blepharoplasty or eliminate the need for a blepharoplasty, which is taking away some excess skin above the eye.
Now, there are some people out there, celebrities, the Hollywood set, Nicole Kidman, that has had this BOTOX just beyond the normal amount. And you see these people with these faces that don't move anymore, and it almost looks mask-like. Where do you draw the line with someone wanting to get this done and still making them look the way they're supposed to look?
Well, the goal is always to have someone look natural, naturally good. I think of those models and actresses and actors as over-BOTOXed. You don't want to put in too much, but everybody after they have BOTOX done can still frown, they can still smile, and they can still look surprised. So you don't have to have that frozen Hollywood look.
You brought along a needle to kind of show, I guess, the actual, is that a vial, is it a syringe, what is that?
This is actually an insulin syringe, and the BOTOX is reconstituted from powder, and depending on how many units you need, you fill this syringe. And units are very important in BOTOX because you want to make sure you have the right number of units to get the effect you want.
On the typical patient, would they use, I guess, a full jar of BOTOX? Would they use a full syringe of BOTOX? How much is like the average amount that you would really need to get in order to achieve pretty natural results?
Well, that's a good question because a lot of people have misconceptions that it's a syringe of BOTOX. Actually, in this syringe, you can have 1 unit up to 30 units. And depending on how many units are in it, you will get different results. The less units, the less results. So you really want to know the number of units, unlike a filler such as Radius or Juvederm, where a syringe means a syringe and it's always the same amount.
Now, essentially, though, you are paying by, I guess, the box. If you want to get it done, this is your container. Can you store it in the fridge and come back and use it 2 months later, or do you use the whole thing at once?
No, you can use the whole thing at once, and you're actually paying by either the site or the unit amount.
Oh, okay.
I like to treat by the site, because then if someone needs 40 units, they get 40 units. If someone needs 20 units, then they get 20 units, and there's no negotiating units. But I do know that they're being sold as a syringe, and that could be 1 unit in it.
Could you clear up the misconception, too, while we're on the subject of Botox? It is botulism that sets up a red flag for a lot of people. Why is botulism in small amounts okay?
This is botulinum toxin type A, and in very tiny amounts, it directly stays in that muscle. It's not a poison. It's very safe. It's been used for many years without any problems. It's used for ticks. It's actually also used for migraines, and we're also now using it for hyperhidrosis, or increased sweating of the palms and soles, under the arms, and even the forehead. Some people have uncontrollable sweating, and Botox is very, very effective.
So that means you don't have to wear deodorant anymore?
That's true. And some people are actually doing it cosmetically. For example, a bride before her special day might want her underarms Botox so she doesn't sweat at all.
Or to get the white stuff on the white dress,
true.
maybe.
Exactly right.
Almost out of time, but is there anyone that possibly should not get Botox for whatever reason?
There is a few different types of patients with conditions such as myasthenia gravis and ALS, amyotrophic lateral sclerosis, where you would not want to do Botox. Those conditions, the muscles are weakened even before you do the Botox, so you wouldn't want to add the Botox to it. But otherwise, pretty much everybody's a candidate.
Thank you so much, and I'll be giving you a call.
Thank you.
All right, if you're interested in more information on Botox, set up a consultation with Dr. Comate. ComateSkin.com is the website. There you can see lots of before and after pictures as well. The phone number toll-free, 888-933.